understanding the opioid epidemic. In the 1990s, pharmaceutical companies introduced new painkillers. They downplayed the negative side effects, essentially hiding the addictiveness in these opioids, while reinforcing the positives. This began the start to an opioid epidemic. Manal Fakhouri compared the opioid epidemic to a stream in her TED Talk. To begin change in the opioid crisis, you must stop the problem at the source. The epidemic started to grow because of the rate doctors were prescribing opioids. Doctors were pushed to do this by big pharmaceutical companies. Pharmaceutical companies profit trillions of dollars a year. Briefly stated in the documentary on the opioid epidemic, insurance companies were covering most, if not all, costs for painkillers, making it very easily accessible to anyone. Becoming addicted to opioids was a positive in the pharmaceutical companies' views because the more opioids prescribed resulted in more money in their pockets. The National Institute on Drug Abuse stated that in 2019, around 50,000 people in the United States died from opioid-related overdoses. Chances are someone you know struggles with opioid abuse. There are 5 schedules in the drug classification from government scheduling. Schedule 1 being the most risk for abuse, and Schedule 5 being the least risk for abuse. Opioids tend to fall in Schedule 1 classification. Brain imaging studies of people addicted to drugs or alcohol show decreased activity in the frontal cortex, says Nora Valkow, director of NIH, National Institute on Drug Abuse. A common stigma surrounding addicts is that they are junkies who need to get a life. In Fakhouri's TED Talk, she urged the audience to reconsider the way they view addicts. She insisted that addicts were everyday people struggling with disease. She only came to realize this after visiting prisons and talking to prisoners who some of had experienced being an addict. In other words, Fakhouri says if more people viewed addicts as actual people who were struggling with disease rather than junkies who threw their life away, there would be more people to fight against this opioid war. A solution to the opioid epidemic could be to prescribe medical marijuana in place of painkillers. Marijuana has been shown successful in treating pain in cancer patients as well as those with autoimmune disorders such as fibromyalgia. According to Reggie Salvador, MD, some other things marijuana has been shown to help in cancer patients is appetite, nausea and vomiting, as well as neuropathy. Some main points we focused on today talking about the opioid epidemic. It began in the late 1990s. Doctors are pushed to prescribe opioids by pharmaceutical companies. Pharmaceutical companies bring in trillions of dollars in revenue a year. Many stigmas surrounding addicts, and medical marijuana could be the answer to stopping the opioid epidemic. Thank you.